Fiona as well, so if I get it wrong, I apologise. I'm Victoria Waller, social media content coordinator for Gig Buddies Cymru. Most of you will probably already know my face already. I'm chairing today's conference. I've been a volunteer for Gig Buddies Cymru for around 2 years or more now, and I feel fortunate and privileged to be part of and work with such an incredible team. At Learning Disability Wales, many came with us, including Simon, Zoe, Sam and everyone. I love my job and I feel very passionate about it. I'm originally from Somerset, which you probably pick up from my voice, but I now live on the beautiful island of Anglesey. I moved here from Dorset around a number of years ago, and since then I've been doing my best to learn the Welsh language. Today is about learning health and well-being. We're going to hear from all sorts of people about different ways to get healthy, stay healthy and improve our well-being. Next week we'll be in Newport to do it all again with a new audience. Before I say anything else, I'd like to thank our friends at Careers Wales who have sponsored today's conference, and to North Wales Together who have sponsored the excellent Changing Places facilities, accessible toilet facilities. You all have a delegate pack, which is probably down to you. There you go. That will tell you everything that's going on and what workshops you are booked on. If you've not booked on your workshop, please go to reception when you came in and make your choice. If anyone has any problems during the day, they can speak to a member of staff from Learning Disability Wales, wearing red polo shirts just like this, but they've probably got LDW written on it as well. Polo shirts. And there are a couple of people wearing Big Buddy shirts right down here. She's wearing some Big Buddy shirts. Before we start, I need to let you know a few things. During the breaks, tea, coffee is in this room and here, so we'll got tea and coffee up here. Lunch is in this room. Toilets are just off the corridor and off to one side. Please turn phones to silent or off. Please do not use flash photography. We'll be taking our own photos today to use on Learning Disability Wales website and social media. If you don't want any photos or film used by LDW, please speak to none of our staff. Now I'd like to ask Zoe Richards, CEO of Learning Disability Wales, onto the stage. Yeah.
Bore da, croeso, good morning, welcome everybody. My name is Zoe Richards, I'm the CEO at Learning Disability Wales. I really struggled saying that. I grew up in Merthyr Tydfil and was ready for the world, but never ready to be a CEO. So anyway, I'm Zoe, and I'm here to welcome you to the conference. Now, every year at conference, I stand at the front and talk about it being my favourite day of the year, and it absolutely is my favourite day of the year, both here in North Wales and down in South Wales. I imagined this morning I would stand here and tell you that we're opening a series of conferences here at North Wales today. Yay! And our series of conferences is one here and one down in South Wales in Newport next week. It's my favourite day of the year because Learning Disability Wales fundamentally is a networking organisation, and we bring the learning disability community together, and there's no better opportunity to do it in the room with people at our conferences. And a little story that I like to tell everyone is about a very small project that started with somebody at our annual conference 6 years ago, saying to one of our members of staff, we've got £3,000, we'd really like you to start a Gig Buddies project. And that was over lunch down in South Wales 6 years ago, and it was First Choice Housing who said they had some money in the pot to spend on Gig Buddies. And at the time we thought, yes, we can start a project with £3,000. We were ambitious. And our ambition paid off, because Gig Buddies now works in 11 local authorities in Wales, and it is more popular than ever. And that started over a conversation about people not being able to socialise at a conference in South Wales. So I think that just demonstrates the power of coming together, sharing our experiences, sharing our stories, and sharing our ambition as well for the learning disability community in Wales. I've got 2 jobs to do this morning, and the first is to let you know that we will be ratifying you. We will be sharing Fran later on. massively to the comms team who've worked tirelessly to get this ready for us. But at the AGM we'll be approving our annual report, but you lucky people get to have one early at the back of the conference today, so if you want to pick one up. It's packed with features, stories, case studies, wonderful pictures. Centrefold is wonderful, but also there's a pull-out section which tells you some of the main things that we've been up to throughout the year. So it's a document that I'm immensely proud of, and although I thank the comms team for getting it ready for us today, I also need to give my thanks to the whole team at Learning Disability Wales. I'm only able to be a CEO because I stand on a big structure that they create below me and allow me to do my job, and they allow me to do my job really well. So a huge thank you to the team at Learning Disability Wales. Us in the red t-shirts. The red t-shirts have been a problem. Last year on the way home I popped into Wilco's and ended up doing Sandra's tutoring shift. This year we were wearing the same t-shirts as the staff in the Premier in the Brewsters for breakfast. So a number of our team got asked for a poached egg from the kitchen. But we are here and we're ready to take your questions and help you all day long in our red t-shirts. And the other exciting piece of news I've got, as well as the annual report, is that Learning Disability Wales' website that has now launched, or I am now formally launching Learning Disability Wales' Easy Read website. So if you go onto our website, you see really clearly a red button at the top saying Easy Read, and we've got some superb information under that section where you can learn all about Learning Disability Wales in Easy Read, but also we'll be adding to resources as well, and resources I'll talk to you later about, which is more exciting things. It's lovely I get to stand here and talk about all the exciting things that we do today. I want to wish Victoria good luck as she chairs our conference, the first chair. Nervous energy. I understand that. Yeah, just the nervous energy, that's one thing to talk about. If you all just sit there and smile, it makes our job much, much easier. So paste that smile upon your faces today to ensure that whoever is standing in this spot here has a good day today and gives you the very best of themselves. Thank you for coming along today. Have a great day. We'll be around. Please stop and chat to us. Ask us about the exciting things that we're doing, that we're sharing from last year, but also the plans we've got from this year. And also our wonderful exhibitors who are dotted throughout the building as well. I noticed there's some freebie scrambling going on already. There are some incredible water bottles for your children. And chocolate roses, so do collect them, but do have a chat to the people on the stands. They have some great things to say as well. So, without further ado, I'm handing back to you, Victoria. Thank you very much.
Okay. Thank you, Zoe. Next up we have, next up to tell us all about annual health checks, we have Sonia Kim and Sophie from Betsy Cavalier. I hope I've screwed that up saying it. University Health Board and Conway Connect as well.
We need 2 microphones.
I thought we were standing this way.
Sonia, I think you're after us.
Okay.
Yeah.
I'm glad you know what we're doing.
I can't see the screen over there. We've got the screen on professional.
Can you see that?
Just about.
Good morning, everyone. I'm Sophie Trow from Conway Connect, and I'm here with our lovely health check champions who are going to talk to you about what they do, what they've been up to this year. So I will hand it over to them.
North Wales Health Check Project,
Conway Connect for Learning Disabilities.
Hello, we are the health check champion. We are here to speak to you about our project, the work we have been doing.
A medical check for your body, for your mental health, if you are 18 or over, once a year.
Let's watch this film we have made about health checks.
Oh, no sound! What have we done to our technical people?
This on it.
Something odd.
Why does it always happen to us?
Exactly.
Because we're first on.
We'll do a song and dance routine.
Nobody else has seen it.
You saw it.
No sound. No sound. I don't know. Do your presentation.
No, it's our presentation.
Introducing. We are the health check champions. Is mine over introducing? No.
I do apologise for the delay, technical problems.
Hi, Mum.
Whilst we're waiting for the video, I'm just going to take us through what we've got going on today, a quick snapshot. So, annual health checks. Then we're going to hear from the Paul Reid Foundation. After that, then we're going to have some tea and coffee. And then I think it's back to me actually, and we're going to launch some accessible information that we have about the menopause. But we're ready to rock and roll. Yeah.
Thank you.
Anyone with a learning disability age 18 or over.
You need to be well at your health check.
No way! Even you still feel amazing, you still need to have check.
So why do I need a health check then? It is very important that it can save your life. Save my life? How can a health check save my life?
Sometimes people can be ill without feeling anything, so it's important to have a doctor check you out. They can give you the right treatment quickly if you need it.
Wow, that's important. I wouldn't have thought of that before. Okay, how do I make an appointment for myself?
Call your you need a health check.
Okay, I will. But do I need to do anything before my appointment?
You can ask for your surgery for easy information about your appointment.
That might make you feel better about going.
Okay, I can do that. Anything else?
Well, you need to get a health check checklist. Then you remember the things you will need to take with you.
A checklist? Where can I get one of those?
They're on the Get Check Out website. The link is here.
Ah, that's handy. What can I do when I get to make my appointment?
The doctor or nurse will check your body. They will check your weight. The blood pressure will be, and also may need to take your blood test.
That's a lot of things, but is it scary?
Oh, don't worry, all the checks will be explained to you so you won't feel nervous.
You should ask any questions you want to, or ask them to stop if you're getting worried.
Remember, it's your appointment and you could decide what's happened.
Makes me feel a lot better. Can I talk about how I'm feeling?
Oh yes, mental health is just as important as having a healthy body.
Talking about how you feel is important too.
How long does the appointment really take?
It take around half an hour. You don't have to rush your appointment.
That's good. Can I have my support with me?
You bring someone with you, they can ask questions too.
That's good. So after my appointment, what will happen to me?
Well, you should get a health action plan.
An action, man.
Oh, I hope done. This is a piece of paper which will have a plan for your health on it.
A plan for what?
A plan of things you can do to keep healthy.
Ah, that's what it is. That's what I remember.
Yes, and if you need any help after your appointment,
Yes. Who do I speak to?
Well, there are a few people who could help.
Support to your family, your doctor's surgery, or us, the health check champion.
So what do I do now?
Save your life! Woo!
we have 8 health check champions.
We have been Tommy Connected team members since August 2021. Our project covers all of North Wales.
Sorry, South Wales.
Our work is funded by Betsy, Cadwallader, Healthford and North Wales together.
We talk about what happens in the health check. We talk about how important health checks are, and we give advice and support to people and professionals.
How do we do it? We have made 2 different workshops for people with learning disabilities and their support. Those workshops tell people about health checks. We deliver them all over North Wales. Ooh.
We have been helping to train hospital staff on how best to support someone with a learning disability.
We've been working with Public Health Wales to help produce their easy read health screening guides.
In 2023 and in 2024, we want to help more people with a learning disability to go for the health check and then have better experience for the health services.
Thank you very much for listening. For more information, please contact this lady called Sophie at Comedy Connect or .org.uk. Anyone, do you have any questions about this our project?
Oh,
I have a question. Thank you very much. And this is for the Health Check Champions. What's the best thing about being a Health Check champion?
Getting paid.
That's going to be my second question.
I enjoy being a health champion. And we like to help other people, and to encourage people to get the job. They go for the health checks, we also travel to the hospitals. I like to talk to different other people as well. James.
I think it's about educating people as well, because there's still a lot of education needed around how people approach people with learning disabilities, and not just health, but other statutory services, and putting the word out there as well.
I think also we like seeing people who don't have a learning disability, making them see what it's like the other side of having a learning disability, with people who've got learning disability, and seeing it from our point of view instead of seeing it from the other side.
And the other thing is we have been doing is we've been giving workshops. We're giving 10 top tips to workshops for nursing as well. What's been really important as well to hospitals and stuff, all around hospitals and stuff. Another question.
And also we also have workshops for parent carers as well, don't we?
Yeah. What's the first time?
Do you enjoy delivering the champions training at the hospitals with health liaison?
Of course we do.
Yeah, we do, because I think it. Sorry, I've got a big voice, so I don't know. I think it's good because not everyone knows about health liaison either. We ourselves can tell people about it, because a lot of people are not aware that they can have someone come to their appointment, or if they're going in for operations, or if they go into A&E and are not well with a learning disability, that they can access the service. So we're also educating other people as well, because I know it's hard for yourselves to do. I know you have a bit of time for education, but it's not just your job. We can support you as well and educate other people as well. There's loads of questions from.
If anyone here thinks of they know someone who might learn from your talks, can they get in touch and ask you to come and give them a talk about health checks?
Why yes, because there's an email there. Just write the email down and we can book some. Yeah, 100%. Yeah, because we have got a website, Common Connect website. Just we got social media as well. Common Connect, Common Connect with Disability website as well.
On Facebook page.
Yeah, on our Facebook page. More hands.
There's a man there first.
No, Grey jumper.
I think your project is so powerful. Just wondering what is the plan really to share it to the rest of Wales, South Wales.
There are other projects, I think, am I right? Yeah. In South Wales, with different health boards that have their own, am I right in saying they do have their own health check champions?
We haven't seen this. We haven't seen this, but this is incredibly powerful.
I'm not sure what areas. I think these two ladies will be able to say a bit more.
There's people first, isn't there? But it's probably not as on the scale that we've got Leeds and
Kilgar and Cardiff and Vale, and they're all playing health check champions. So we're trying to extend it across Wales. I'm sorry, I hope that helps.
We basically put South Wales to shame.
Thank you very much for an excellent presentation. Diolch yn fawr iawn, iawn. Can I just gofyn, ydych chi'n gweithio?
Do you mind if you speak English?
I'm more than happy to, not a problem. Not a problem. I'll do both.
Dwi'n dall.
Shall I do both? No, no.
Gei di siarad Cymraeg, dwi'n dall Cymraeg.
Popeth yn iawn, I can do both. It's okay. I just wondered, do you also work through Ysbyty Gwynedd, the North West Wales?
Yeah, we do, yeah.
West Wales gets a bit forgotten.
Yeah, we have. We recently did, because you've got an education room there, haven't you, upstairs in Ysbyty Gwynedd?
I'm not sure.
Yeah. We have been there to talk to student nurses around the project, but we're hoping, it's hard to get staff off the wards, isn't it?
Yeah.
Because I know you're so busy, and that's the thing is...
And we're such a wide area.
We are, that's the issue. But no, we do go to Ysbyty Gwynedd.
Thank you very, very much, and I wish you well with the project.
Thank you very much.
Diolch.
Diolch yn fawr.
Can I just ask, you had a link on there around getting the checklist. Is there a possibility of sharing that link again to you? I think it's a get checked out, but I couldn't get the rest of the address, so for that checklist,
Get out, checked out, North Wales.
Get checked out.
Yeah.
And it's all, is it all easy read? Yeah, it's all easy read,
Thank you.
You have to put North Wales in though, because there is one.
North Wales to get checked out, north.org.uk.
But we'll give it you after.
Great, thank you.
Any more? Or have we finished? Any more questions?
Right, we're going to pass on to...
Thank you, everyone.
to Sonia.
How on earth are we going to follow that? We've now got the Ant and Dec of the health world.
We try. So, can you hear me? Is it working? Yeah. So we're, myself, Sonia, here to talk about health checks for people with learning disabilities. So those of you who don't know us, it's not on. Do you know what? Can you hear me without it? Yeah, I'm better off without one, to be honest. I might start singing karaoke with one. So, for those who don't know us, I'm Kim Scandaliato. I'm the matron of the health liaison across North Wales. And this is my colleague Sonia, who's the senior lead for primary liaison across North Wales. So, who are we? Because this is something we've been around since 2005. We've been in primary since 2005, and we've been in the hospital since 2010. So it really concerns me that people haven't heard of us, because we make a lot of effort to get out there and tell people who we are. So we cover all areas across North Wales. So that's primary and secondary and the hospitals. So we cover Wrexham, Flintshire, Denbighshire, Conway, Gwynedd and Anglesey. Gwynedd, I must say, picking up on what Sian was saying, Gwynedd is a really, really vast area, massive. We're putting quite a lot of resource into Gwynedd at the moment to try and bring Gwynedd up to where everywhere else is in North Wales. But I take that, Shan, it's been really difficult over there to recruit nurses and, you know, to get this going at the pace we'd like it to. So, who are we then? Who's in our team? So we've got primary health liaison nurses, they work with the GPs. We make sure all the GP registers are up to date. We make sure that everybody who's known to services over 18 is on that list. We are an over 18s team, I will say that now. We don't work with children under 18, only adults over 18. We've just employed a professional development project nurse who's on a 2-year fixed term contract. She's going to deliver a brand new idea for health checks in North Wales. I'll answer any questions on that after, but I don't want it to overtake the session because it's brand new and it hasn't actually gone out for launch yet. It will be in the next 2 or 3 weeks, hopefully. We have acute liaison nurses, they work in the 3 main hospitals. So at the moment we cover the district general hospitals. So that's Ysbyty Gwynedd, Ysbyty Glan-Clwyd and Wrexham Myler. So we've got acute liaison nurses in those hospitals. We've got 2 dysphagia nurses. They're specialist nurses, they're highly trained, highly skilled, and they work with people with swallowing problems. But this is a West-only project. It's a historical thing, and hopefully we're looking at plans to maybe look at a dedicated dysphagia team that would cover the whole of North Wales. But that's very early days, so you'll have to bear with us. Healthcare support workers, we have brilliant healthcare support workers. Kemlin's there now. They are absolutely fabulous. I can't sing their praises enough, they are brilliant. They will support people going in when they're in hospital, if there's issues around support. They will support people to attend health appointments if that's appropriate. So they're absolutely phenomenal. Oh, you've left me on.
I did.
Oh, so sorry about that. I blame my colleagues for that. So yeah, I'm not the boss. We're all boss in my team. I'm not the boss. So I was going to say that the drawback with this service is we're a 9 to 5, Monday to Friday service. There is nothing after hours. There's no out of hours service. Although I must say our acute liaison nurses, one of them was in the hospital at 7 o'clock yesterday morning to support somebody. So we can be flexible within that time, but we are a 9 to 5 service. I'd like to change that, but that's the way it is at the moment. So what do we do? So we provide information about health checks. We work really closely with these fabulous health check champions, what can I say? We work with GPs to make reasonable adjustments. The new project that we've got coming out is specifically around trying to make reasonable adjustments for people who are really struggling to access their health check for whatever reason. We provide training to healthcare professionals. We provide easy read information, give support to those who are afraid of medical tests, help to improve people's stay when they're in hospital, talk to people about how to stay healthy. So why should we have a health check?
Yeah, why?
Well, if you were listening and looked at the video, the answers were in the video.
I'm just teasing you to see if people are listening.
Does anybody want to shout out why we should have a health check?
Come on, everyone. I don't want to say because we've been the health check champions, so I don't want to say.
Well done.
Yes. Brilliant. So we have got a really in perspective here.
Some friendly germs.
Yes. So there's many diseases and conditions out there, and a lot of them can do you harm without you knowing about them. So it's really important that these diseases and conditions can be found early. and treated. Not everybody's got them, so don't all sit here thinking, oh my God, I might have them. But you know, for peace of mind, it's good to know that you haven't, and that's where the health check comes in. It's really important. Well, I'm over to you, so.
Okay, thank you. So as Kim says, it is important to have a health check because having a health check can make sure you are getting the right treatment at the right time. Okay, so another question for you. What happens in a health check? So those that have had a health check, can you shout out what things do we cover in a health check?
Blood pressure.
Blood pressure,
Diabetes.
diabetes, yeah, they check for diabetes. Weight, well done, you were listening. So we've got a few things up here that some of the audience members have shouted out. Blood pressure as well, yeah. And the height.
Ask you for the questions about your health.
Spot on, that's why you're a health check champion. Yeah. So we've got the weight, they might listen to your chest as well. Blood pressure. They'll look into your ears as well. So if they haven't looked into your ears, remind them, look inside my ears, just in case you've got wax. They also check your weed, don't they? I think Richard said that on the video. You might need a blood test, not always, but if you're worried about needles, then come to us because we will help you with what we call desensitisation. Big long word, but it means we'll help you get used to having a needle. Okay? And as Richard said again, you're asked some questions about your health. Whether you smoke, or you drink, or do exercise. So yeah, well done. So, have you completed your health profile? Now, up in, right, we'll get you afterwards. Up in North Wales, you might be used to seeing the traffic light hospital assessment. That was with the red, amber and green. But we now have an all Wales health profile from our colleagues from Improvement Cymru. So we have got some, and there's some out around the audience at the back there you go. Laura's holding them up. So please pick them up, and if you fill them out and take them with you, if you need to go into hospital, then it's really useful because we're training our nurses and doctors to ask for these documents so that they can understand your needs better. Okay? And there you go, there's the Get Checked Out North Wales website. Again, we've checked out northwales.org.uk. Yeah, spot on. So yeah, there's lots of resources in there. We've got some videos that we've done with Conway Connect and the Health Check Champions. There's stuff on there about flu, and when COVID came out, there's a COVID video. A little bit outdated now because things change so quickly. But the general gist of everything is on that website. So you can find videos about a health check as well, and members of our team and how to get hold of us. This is what Kim was alluding to, talking about before. It's our new plan called Lab in a Bag. So it's a new tool to support the delivery of the annual health checks for citizens who are unable to get to the GPs. So the idea is that we will go out to them and do a health check. But it's not for everybody, it's for those that really, really cannot get to the GPs themselves.
Yeah,
so watch this space.
It's not in isolation to the GPs either. The GPs have to play their part in it. All we're doing is the basic observations, and then, we'll come and talk to you again about that, I think. Yeah. Once it's up and running, we'll come and talk to you again about it. And
so there's our team contacts.
You haven't got Simon on there?
Yeah, he's at the
I have
bottom.
got Simon. I have left Simon out.
You don't miss a trick, do you? No, all our numbers will be on our team leaflet that's on our stand at the front of the building here in reception. And I think, do you have any questions for us?
Finalment ymlaen, before we go any further, os ti'n moyn gofyn cwestiynau yn Cymraeg, please, gofyn eich cwestiynau yn Cymraeg. Mae gwasanaeth cyfieithiad gyda ni today. We've got a translation service here today, so if you want to ask your questions in Welsh, please use your Welsh. You're very welcome to. Bydd Eira yn mynd i esbonio sut i ddefnyddio teclynau now. So can you give a minute? Diolch yn fawr. Eira's going to explain how to use the equipment now.
So which one is revealing? On the right hand side there's a switch, on off switch. Yeah?
It's one of you guys, isn't it?
Yes, and there's no much questions.
So if someone speaks in Welsh, she'll give the English.
And then the volume control is on the left hand side of the panel here.
Diolch yn fawr, sorry.
Thank you. No. Just to let you know, our presentation is available in Welsh if anybody wants it's in Welsh. We'll record it.
When you're not using these, could you just switch the box off so that you can see the back sheet, please? Thank you.
That's fine. So, any questions? Oh, okay. Have I got to run round?
Yeah. I'd start from the back, I would.
I'm happy to shout because it's not a question.
Yeah.
It's a shame that people were asking for the
I'll help you.
people were asking for the address for Get Checked Out, and we've got environmentally friendly cardboard pens here.
More questions?
Right, I'm Sonia's helper. Right, you're the first lady.
I don't know if this is a question for you or for the Health Check Champions. How easy is it for people to get a GP appointment for a health check when it's quite difficult for people to get emergency GP appointments? Is it easy for people? Will the doctors prioritise a health check?
I don't think they'll prioritise. I'll be honest. Some GPs in North Wales are much, much better than others. So we've already got GPs who have done 50 annual health checks, every single person on their list for this year, and the year doesn't end until March. But we've got GPs out there that it's really difficult to get them to do one annual health check. So so it goes on area, it goes on how many have got locum GPs rather than permanent GPs. That all has an impact. What I would say is, if you're having problems getting an annual health check, get in touch with us, because we can help facilitate that and get it done, quicker, and also we can pick up on the GPs that people are having major problems with. We recently become part of the clusters. So in the 3 areas, the clusters are there. So Gwynedd, it's west, central, east. They've got clusters, and all the GPs are part of those clusters. So we've got into their meetings, so we can push all this forward. So, but we don't know if nobody tells us. That's we need the feedback. So we need to know. Is that okay? Yeah.
Who was the second hand up? Sorry.
Mark.
No.
Go on.
Thank you.
Hi.
Can you hear me?
Yeah.
I think I'd like actually connected to that question really, because I'm curious about whether we've seen an increase in the percentage of people getting their health check. And obviously we had COVID, so that kind of, but whether we see that coming up now. And I appreciate that, as you're saying, there are a range of different things that need to happen to really get to where we want to be. I'm just interested.
So we had a 7% increase from last year, from the year before, because we're always a year behind with our data. So it was a 7% increase.
And then we're not this year. We won't actually know until probably
April next year.
Yeah, probably May, June. But we're fingers crossed. Every little increase increase is something that's really good. So thank you, thanks for the question.
Hi, it's Wayne here from Makeup Cymru and trustee of the Learning Disability Wales. I don't know if people are aware, but it's actually 20 years since the woman who sort of launched the campaign to introduce annual health checks passed away in North England. She died of cervical cancer that wasn't picked up by her doctor, which led to the campaign that we ran with David Melding to get annual health checks introduced in Wales. One of the questions I want to understand is what happens in terms of the follow-up, because one of the challenges, of course, is that you can go through your annual health check, it'll give you a list of things or concerns that might be something we need to look at, but actually no support is given to people with a learning disability after that to follow up on those concerns. What do you do in North Wales to ensure that the recommendations from a health plan that comes from an annual health check is followed up and that person is supported?
Well, do you want to answer
Yeah,
that?
that's a very good question. We do work alongside the GPs. They will know about our referral system. So if they, for example, there was a young lady that had to have a repeat sort of smear, so the referral would come in and then we would work alongside that person to ensure that they had the information accessible so that they can make an informed decision about where they're going to go, what treatments. So yeah, we've got a referral system in which the GPs, when we go round and do the learning disability Padlet training with them, then they're aware of how to refer into us. And the same for the citizens themselves. They know about the Get Checked Out website and our details, and they can refer themselves in. I've worked with somebody here at the audience that rang me up and said, can you come and help me? And I was like, yeah, that's fine.
We are looking at summary records, so rather than true health action plans, because we tried those a long time ago in North Wales, they weren't successful. So what we're looking at the moment, in line with this lab in the back, is about summary record sheets. So the GPs always have them at the end. What we're looking at is whether that can be condensed into a tick box and that can be given to the person. So it would just have basic information. Do I need a follow-up? Do I need bloods doing? Do I need anything afterwards? So it would be an A4 sheet. It wouldn't be reams and reams of information, just because I think that's missing. I agree with you, Wayne. I think that's a bit that's missing. People have their annual health and they don't know what happens afterwards. So I'm really sorry we've been told that we have to take any more questions.
Can I just say, mae hwnna mor bwysig, mae o'n pwynt pwysig iawn. It's a really important point. And I think your role is amazing, and the work you do, and we can't thank you enough for the years that you've done it. But there needs to be responsibility on GPs to follow up. Mae o'n gyfrifoldeb arnyn nhw. It mustn't become a checklist for the GPs to have done and to be paid for the service of doing it. It has to follow through, and I agree with Wayne, mae'r rhaid cario ymlaen a gweld pwy sydd yn gyfrifol. Pwy sydd yn gyfrifol, am wedyn cefnogi'r person yna i gael y gofal gorau. Rhai bobl dal yn byw efo teuluoedd sydd yn mynd yn hen, people still living with elderly families, and they need that support to make that next step. So diolch i chi am eich gwaith. Thank you for your work. Diolch yn fawr.
Thanks all three of you, Sonia, Kim and Sophie, and Comedy Connect, and Kim and Fran, of course. Thank you all three of you. I know Sophie has to leave us soon, but Kim and Sonia should be around for the rest of the day if you want to talk to them any more about their work. And I think Still's out the front, am I right? You're out? Yeah, just checking because I forget otherwise. So they'll be around for the rest of the day, but Sophie has to leave us. But we now have Jonathan Ridd, who has travelled all the way from Port Talbot, it's a hell of a long way, to tell us about improving healthcare for people with learning disability and what the Paul Rich Foundation does. Croeso I London, no, Jonathan.
Well, I have no idea how to follow that.
project and the work you're doing. Amazing. And we do feel privileged as a foundation to have had a connection with Kim and the North Wales team for many, many years to share the work and work together. So thanks again for that.
Thank you.
So my talk is going to be quite bland in comparison, so I apologise up front for that. And firstly, I'd like to thank Learning Disability Wales for giving us the opportunity to be here today. Thank you very much. So what have we done as a family, really? Is it? Yeah, so the Paul Lloyd Foundation was set up after my brother Paul sort of died a preventable death, if you like. He was let down at the start of his life. And every time I tell the story, we show the photographs to, see that Paul had a quality of life, because there was numerous people in quite high positions in government, coroners that told us that they didn't have a quality of life. So I think these photographs ultimately show, and we're very proud of that, and privileged to have had Paul as my brother and a family member. So just to give you a very short version of Paul's story, he had a very unfortunate start to his life when he was born with a Cordran's neck, stabbed the oxygen to his brain, made him severely a severe mental disability. And then later on in his life, then through other illnesses, that he was let down again by the NHS at Morrison Hospital. So at Paul's birth, this happened. Our parents were aware of that. It was only 2 years later that it was discovered that Paul wasn't developing like a normal baby, and then numerous checks were done. Paul was taken to Great Ormond Street after, like I say, many specialists that sort of looked at Paul, done tests, and realised that what had happened at his birth was permanent, and there was nothing that could be done to improve his condition. Paul then lived with our parents up to the age of 9 in Talbot, before he was then taken to Hensel Castle Hospital. Some of you in the room may be aware of that. That was the only facility back then. He was back in the 60s, of which then Paul needed 24-hour care, and he was taken there. And that was mainly due to Paul developing petit mal fits, falling fits, so it was for his own safety he needed that 24-hour care. At the age of 9, he was on an award in Hensel there. He was the youngest and the oldest was 90. So just to give a little bit of perspective of when he was 60 on that ward. So throughout Paul's life, he had numerous health problems. One of them being a lazy bowel, which kept sort of repeating throughout his time. When he was at Hensel, he had 2 operations to cut sections of his bowel out, as he had blockages that couldn't be removed, so they had to remove sections of Paul's bowel. He spent 36 years at Hensel, Paul. Then he was moved to a bungalow quite local to where we live in Talbot, a couple of miles away, which was great for us, although we'd go to Hensel and see him every single week as a family from a very young age. Then he became much more accessible to us as me and my sister sort of grew up, that we could have a bigger part in Paul's life. So during Paul's time then in the bungalow, he moved there in 2001, and when Hensel shut, and the lazy bowel problem continued. He was taken to the local GP numerous times, basically only to be given Movicol and to be sent away and say, that should remove this sort of blockage. So Paul would walk around with a very swollen stomach, in a lot of pain, and like I say, a lot of distress for him and the family and carers really. And there's a good point there, we talk about annual health checks as something we campaign, aggressively for more quality annual health checks to be done, because there was a serious point missed at that time, which we didn't realise as a family, because we were emotionally connected. there wasn't a great deal of awareness around it, and it was a tick box exercise, unfortunately. But we were never given the options to sit down and have a chat about this, and it might have been that the GP said, right, let's scan Paul, let's have a look and say, right, okay, the best option for Paul would be to have a bag at that time. If that had happened, Paul may still be here today. So moving on to sort of December then, 2008, Paul was taken, the problem reoccurred again. He was taken to Singleton Hospital, which they temporarily removed the problem in theatre for a couple of days. He was let back out. They didn't scan him, so they didn't look any deeper into the problem to see the condition of his bowel. And then New Year's Eve 2008, he was then rushed into Morriston Hospital, blue light, as his bowel had perforated. He then spent 21 days in ITU. He had an operation which was successful, 6-7 hour operation. Surgeon done a fantastic job saving Paul's life. Ended up on ITU, quite difficult to get him off a ventilator. And during that time he developed lipid pneumonia from that, which again wasn't told to us as a family. So communication again is something we really campaign for as family carers to discuss these things. We're aware and we can help in any way. Paul then was removed off ITU, HDU, onto a general ward prematurely, where he spent the next 4 days. The nursing care was dire, and the medical staff again sort of didn't know really how to approach him and deal with it. It was like a bit of fear then, if you like. So there was certainly a lack of awareness training at that time on review of that. Paul his pneumonia was still quite aggressive, as they'd removed a tracheotomy that was removing the secretions from his lungs prematurely. And the doctor came to the door on the night that he died, looked at the door and said, he's agitated, give him diazepam. And 3 hours later, Paul passed away. So after Paul's death, me and my sister then thought, right, okay, this doesn't feel right, there's something wrong here, we need to present some questions. So we wrote to the health board, we wrote to the coroner, and anyone else that we could think of that would answer the questions. There was 30-odd questions that we put together. So we had numerous meetings with the health board professionals, including surgeons that had been involved in Paul's care. But unfortunately, although they answered all the sort of soft questions, as I call it, they couldn't answer the main questions of why did they remove his tracheotomy prematurely? Why was he put on a general ward when he wasn't fit to be put on a general ward? And some good stuff has come out of that now, because there's a boomerang system now of whereas they have to be checked 4 or 6 hours afterwards, regular check to see that when you go from ITU, HDU to general ward, that if you're not fit enough, then you go back. But at that time, that system wasn't in place, and that will help us all. So, like I say, we had many meetings, and then we ended up, there was a proper assessment again, which was quite sort of soft and blamed everything on nursing care. But it was the medical care, unfortunately, that let it all down in the end, medical decisions. So we went to the Ombudsman listened to us, done a thorough investigation, and sort of confirmed what Jane and I were thinking in terms of how he was let down. So, and we were supported throughout that process by MENCAP and many others, which we are very grateful for. So there was an inquest into Paul's death, which is another very interesting one. Again, the coroner was one of the first people that we wrote to, because we wanted Paul to have an independent post-mortem. We didn't want anything to be covered up. And Jane and I went to see the coroner, I think it was 3 or 4 days after Paul's death in Swansea, and as we were walking through the door, and he said to us, if this is about compensation, your brother's life wasn't worth anything. But later on, that helped us in many, many ways. So just on that point with the coroner is then, so we had the inquest, and then the verdict came out that Paul had died from gross neglect, and we had a serious apology from the coroner at that point then, because independence was brought in. So it did work out in the end that the verdict was was correct. So the key recommendations from the Ombudsman was learning disability awareness training, which was quite flaky at the time and non-existent in most areas. Robust supervision of doctors, so that's about, you know, removing a tracheotomy prematurely, putting him on a general ward, which he shouldn't have been. And care plans, there was no care plan for Paul in place. It was like as if they had no idea how to, and he was very flat because he'd gone through a major operation, they had no idea how to approach him. They never listened to us as families to go, so we could explain what Paul was like as a person generally, without us sort of telling them numerous times. It was like as if they weren't listening. And then you can see what the Ombudsman said on the news. But this gave us a platform for change as a family, because all Jane and I wanted was to change you know, healthcare for people with disability, make it better, secondary healthcare. So we then, with the help of Wayne and his team, we started with the UK government, thinking, right, we've got to lobby these lot, and the Welsh government. So we had the opportunity to speak to people that could sort of try and influence policy then, if you like. So the outcome of it all then, after having many meetings with the Welsh government and them originally offering a small pot of money for some training, which then not a lot of people turned up, we had to look at other ways. So we joined what's called now Swansea Bay Health Board in a pathway implementation group to then create a care bundle for people with learning disability accessing secondary care. That was launched by Mark Drakeford in the Senate 2014, document quite small, virtually a one-pager, 7 interventions, as me and Wayne speak about quite a bit. It's very basic. So we thought, yeah, we've made this now, this is going to be the change. This is, every health board is going to embrace this now and make a difference. Gosh, it was one word that was missing, and that was implementation. So we continue to campaign then, other things that we've done. North Wales has had a liaison service from DOT, pretty much, and led that, and there's a lot of lessons in South Wales that can be learned from the way you guys do things up here. But at that particular point, I think there was only 2, which was you guys, and now there's 20 learning disability nurses across Wales. So with the support then of many followers and many people helping us with a bit of funding, and again we produced logo packs. So when I go back to sort of the logo, which is the logo here, it's been adopted across Wales, but it was originally the traffic light system, so it's important information about the person with learning disability. You can't see it on here now, but it's the colours, yeah, red, amber, green. Communication, the importance of communication, patient-centred care. So this logo actually means something, and the logo is just a gentle reminder for hospital staff to know that that person's got a learning disability, and ask for the health profile, ask about the information. And we've also trained over 4,500 champions, because as we could see with the process of the gap with having only 2 at a time of liaison with the liaison service, then we thought, right, how can we fix this? So we run a project to just train as many champions as possible on each ward, around the care bundle, around the information that was available that could potentially fill that gap. And then out of hours then, which is still a problem now. So awareness training was always something high on the agenda, but it was like, how do you make it mandatory? How do we get this to a point that you culturise this type of thing? So we went to the Senate, we put a petition in, it was debated, unanimous decision, which made then mandatory training, which was launched then in April 2022. Again, thought, my gosh, we've made it now again, there's mandatory training. There's 3 tiers of this. It's only tier 1, the foundation level, that has been launched. But it's been a real battle, and still a battle, and thanks to my colleague Bridget, our charity manager, if she didn't constantly chase CEOs of these health boards to get more people through this training, it would fall flat 100%, and we never stop with that, Bridget, really. So again, we've had to change our focus a little bit, and we've had connections with universities all across Wales, including Bangor. So we do Bangor online, which is brilliant. So we've got dates in the diary, and we have done for the past couple of years. But we do then awareness training for the students in the universities, because we can capture the students, set a seed early on, get them to do this mandatory training, which they have an accessibility to now, which is something, again, that we push to make happen. So all the focus was sort of on healthcare professionals, hospitals, staff, that sort of thing. We thought, right, okay, how do we share this, like you guys are doing up here now, the fantastic work that you're doing, is, so we then produced book blasts again with the support of MenCap, to provide to families and carers, to make them aware of what is available to them. And Laura and Beth have copies of these up there in English and in Welsh, so please take a copy of the booklets. That'd be great if you could. So to try and promote this, Bridget has organised a number of road shows. We've done one here yesterday, which connected, various different stakeholders and that. But again, it's just trying to raise this awareness that what is available, what a person with a learning disability should be asking when they go into hospital, making them aware of what is available to them. So our future plans, we have a massive future plans, and it's Bridget 2 days, and me when I can spare a little bit of time. But funding has always been our restriction, unfortunately. Is as a family we have, and with the help of MenCap and a very small lottery grant, that we've been able to keep going. But Jane Lai effectively has funded all of the majority of our work, which it's quite a lot. But we won't stop, we want to keep going. So we are going to put in a grant soon now with Big Lottery and others to try and work on sort of these areas of work, to just keep raising awareness, keep making people understand. And it's something, we have a motto, is something that didn't happen for Paul, unfortunately, and is to see the person and not the disability. That's it. Thank you very much.
Paul's happy to take any questions. Not from, sorry.
The other one.
The other one, sorry. My bad. Jonathan, not Paul, sorry. You might want to grab the microphone just in case.
We've got time for one question.
Sorry, I messed that up. I apologise.
To the ombudsman, there is a big issue I find within healthcare in general. When you put a complaint in and then the health board don't deal with it and you go to the ombudsman, you find yourself that sometimes your services can get stopped. There can be repercussions. And I find a lot, myself as a learning disability, a lot of the people as well that have an issue putting complaints in. So how did you find it with the ombudsman? Because, let's say, if I know your brother had passed away then when you went to the ombudsman, but as now, I think, as say, if I wanted to complain and I had to stick to the ombudsman, I think a lot of people are very scared to go to the ombudsman. And there can be repercussions from complaining as well.
Okay. I don't think there should be repercussions. I think you're more entitled to make a complaint if something's not right, and that's the only way that lessons or things will be changed, lessons will be learned, and changes will be made for the better. So please, don't.
Did you get a lot of support then to do?
We were lucky as a family, we were quite strong, and we could do that, and me and my sister used each other. And as a charity, we do sort of help people, guide them through that process, because we've been through that. But I'd say never be fearful about making a complaint, because if it's a complaint, it should be dealt with accordingly, and you shouldn't be punished for that. So never ever feel guilty about making a complaint, because it's all you're doing is raising something that needs to be improved for somebody else. So all the work that we've done is all about a family not going through what we went through.
Yeah, it's just I've heard of the story
Without
some health boards, there have been repercussions for some services.
It shouldn't be. And if there are, contact us, and we will help.
Oh, thank you very much. Thank you. Yeah.
To use some Welsh, so I'm still learning it. We now have our first break of the day. I'm just break time. During the break, please go and visit our exhibitors. They are located back towards the reception area. We also have the accessible toilet facilities and changing places here, which are just outside reception in the car park area. If you've not signed up for workshops, please go and visit the registration desk to make your choices. It's back here about 11:20. Oh, is it? So, sorry. Yeah, so we're probably about ready to start back. Everyone, welcome back from the break. Hope you had a great time and a chance to look around the stall, especially the reception area here. I'm going to introduce Zoe Richards, CEO of Learning Disability Wales, who will be talking about menopause and some new accessible information about it. So,
thank you, Victoria. The one thing that I've been instructed to do is to let you know that there's a hashtag as well for today. So if you are using social media, please do use our hashtag. It's hashtag LoveYourHealth23. Capitals on the love, your, on the L, Y, H. Yes, it's displayed just here. I'm going to take a selfie.
Can I have a selfie with you?
Yeah. Turn this way. We want the audience. Thank you, and I'll use the hashtag. That's what my children call the Momulam photo, and I just use my forehead in the photo. Anyway, menopause information. Where am I on the... Okay, so our Easy Read service, we have an Easy Read team in Learning Disability Wales, and for the most part what they do is translate documents. They translate documents for all sorts of organisations, health boards, other charities, Welsh Government. So they do a lot of translation, but what we also want to do is ensure that people are able to have access to good quality information about the things that they want to know about, not what people want them to know about. So we put a survey out to our members and yourselves this year to find out what the topics that are really important to people. And two big topics came back. The first was better information on the menopause, and we definitely all need that, and better information about having a relationship. So we started that work, and our team have worked with a few organisations to make sure that it's good quality factual information, that it's relevant to Wales, that it's relevant and appropriate for people using Easy Read. So we ensured that we went to partners, and we worked with the Menopause Charity, and the Menopause Charity fundamentally ensured that we were using trusted information in our Easy Read leaflets, and that they clinically signed off the information as well for us. We worked with Fair Treatment for Women in Wales, and that was to ensure, because Menopause Charity are a UK-based charity, so Fair Treatment for Women in Wales ensured that it was within the context for Welsh women. And we also worked with Come Taff People First, and Come Taff People First then checked our Easy Read, so give us our gold stamp in terms of being the best Easy Read document we could have. So the we were originally going to do one document, but it was quite a large document, so we decided to split it down into 4 documents, as you can see. Keeping healthy in perimenopause and menopause. What is the perimenopause and menopause? Number 2, what are the symptoms? Number 3, what can you do to feel better? And number 4, how do you talk to your doctor? So we've got those available today at the Easy Read stand for you to see. Just, I'm clicking the wrong way here. Sorry, this is an example of our Easy Read. Can I just take a measure in the room? Hands up those who know what Easy Read is. Most of you, great. One's done. That's great news. So we've got the stand up there. Please do visit the stand, pick up that information. We are also looking to do our relationship piece of information next, and that will be our next piece of work. So please visit the stand and see what we've got there. In our post-conference information that we put out, you'll see videos from both Fair Treatment for Women in Wales and Menopause Charity. Think about the work that they put into the booklets as well. Thank you very much. I'm going to come back to you to explain what's next. It will be on the website. Yes.
Welcome back, everyone. Like I say, I hope you had a chance to visit our wonderful activities during the break. We now have our first workshops of the day. Your workshop choice will be in your delegate packs that you got when you came in, if you registered. If not, obviously go back to reception and make your choice. They are how the arts can help mental health and well-being, which is in Ogwen, which again is down one of the rooms down the corridor. In fact, all rooms down the corridor. Healthy sexuality and intimacy in the LC room. Improving vaccination information will be in this room, so if you're doing the vaccination one, you'll stay put. Mindfulness in Brennick. Please go straight to your workshop now. After the workshop, lunch will be served here in the conference room. Just about. Guys, can you all hear me all right? Yeah. So the live stream can hear me as well. And welcome back, everyone. I hope you enjoyed your lunch. We now have a special part of our conference. We're joined by the talented actors from Hygiene. Brackets are all winning as well. Please give a big round of applause to Susan, William and Lloyd.
Thank you, Victoria. Hello, everyone. Thank you. Hello. Oh, that's a nice, lively response, especially after lunch. We're delighted to be here with you today. So, as Victoria said, we are Hygiene. We've been coming to the Learning Disability Wales conferences for quite a long time now. It's It's a real highlight of our year. So I'm not going to go into my usual spiel about who hijinks are, but just in brief, if you haven't heard of us, we are an inclusive theatre company. We're based in Cardiff, but we work with actors all over Wales. And Will is one of our actors from our North Academy. Yay! So my name is Susan, and I'll be facilitating today's session. And as I said, we have Will here. Would you like to say hello, Will? Hello. And we also have Lloyd, is our other actor. Lloyd, would you like to say hello? Hello. Or Lloydie, as Victoria said. That's a good name. You look like a Lloydie to me. Great. And we're going to be presenting a scenario that we've developed through conversations with our actors that is based around the topics of health. And crucially, the barriers to health that might exist for people. But before we start that, we are a theatre company, and our sessions are interactive, and we like to think energised. So we're going to start with a little warm-up. Not that you need it, because you all seem very awake. So I'm going to put my microphone down now, and I'm going to invite you to do something called the funky chicken. I asked Will if he wanted to lead this bit, and he said no thanks. So he's leaving me, throwing me under the bus here. So I'm going to put my microphone down, and invite you all to stand up. Oh, God. Try not to hurt anyone. Quick fire. This is just a quick fire shakedown. So we're going to shake out each of our arms and legs and just do what you're comfortable with, but also we're going to count down together. And the point of this is it gets the blood flowing, gets us all a bit relaxed and ready to interact. But as I said, you seem ready to interact anyway. So we're going to start with 5, and we're going to do 5, 4, 3, 2, 1, 5, 4, 3, 2, 1, 5, 4, 3, 2, 1, 5, 4, 3, 2, 1. We're going to go down from 4, 3, 2, 1. And at the end then, we're going to bring our arms forward and we're all going to say together, funky chicken. Oh, God, exactly. Okay, are we ready? Hold your arm up. Okay, I can't lift this up very high. I can't lift it up far shoulder. So do what you can, okay? Ready? And 5, 4, 3, 2, 1. 5, 4, 3, 2, 1. 5, 4, 3, 2, 1. 5, 4, 3, 2, 1. 4, 3, 2, 1. 4, 3, 2, 1. 4, 3, 2, 1. 4, 3, 2, 1. 3, 2, 1. 3, 2, 1. 3, 2, 1. 3, 2, 1. 2, 1, 2, 1.
Anybody else with a stiff drink?
Hopefully those sitting at home did that at home as well. That's entertaining. Lovely. Okay. Thank you all very much for getting involved there. So, without further ado, we're going to move into the scenario. So, just to let you know the setting, as I said, we have Will, who's playing the part of Darren. And Darren is at home. He lives in supported living. And Ellis is played by Lloyd, who is arriving for his shift that day, and he is Darren's support worker. I'm going to ask you just to watch the scene through, and then we will be asking you for your thoughts and comments. And Fran is going to be helping us with the microphone. Yes? My very glamorous assistant I'm helped with today. And I'm going to be asking you to pay particular attention to the character, to Will's character, Darren, and what it is you think he wants and needs in this situation. Okay? So, without further ado, let's watch our scene through. So, Will, if you want to get into position.
Darren, my friend, good morning, how you doing? I feel so energized today. And guess what I did this morning? No, I swam all the way from Prestatyn to Will. And now I'm here, ready for my shift. Healthy snacks, remember? What have you been up to then?
Just relaxing.
Relaxing? What shall we do today, my friend?
I don't know, what do you fancy doing?
Well, it's your day, isn't it? I mean, could go for a run. You said you wanted to get fit, didn't you?
Maybe a bit of a walk, I think that would be better.
Walk? A walk's not going to get your heart rate up. I'll tell you what, I think I've got a free guest pass to my gym. Come down with me, I can whip you to shape.
It's just, how can I say this? I haven't been feeling very well recently, and I thought, I don't know, maybe we could have a bit of a chat.
Yeah, sure, mate.
It's just, I have been having eating problems. Yeah, I just can't stop eating.
Oh, you're serious?
Yeah, I just can't stop. I know it sounds silly, but I think I need to make an appointment with my GP. My mate Jack said something about annual health check. Apparently I should be getting one.
Health check, don't worry about that stuff, mate. Look, I found my pass. You just need to come to the gym with me.
I don't know. I was thinking my GP could refer me to a dietitian.
Mate, don't worry about all that stuff. Do you know what the best thing is? It really helped me. Triathlon. Oh, what? It's brilliant. So basically, you can eat as much as you like because you burn it all off. Basic maths. I eat over 3,000 calories a day. Look at me. You should join in on my program.
I'm not sure.
Honestly, mate, look, stick with me and I'll sort you right out. In fact, I think I've got my exercise stuff with me today. No time like the present. You should, let's go down now.
I don't know.
Oh, come on, mate, carpe diem and seize the day and all that.
It's just, I didn't really like it last time.
What, the gym? Yeah, that's because you didn't have me last time, did you, mate? Honestly, we'll do it together. You won't regret it.
I don't know.
Well, what else are you going to do? Just sit around here mucking all day?
Maybe.
No, come on, get your stuff. Have you got a vest, some shorts?
No, I don't.
Not to worry, okay. We'll just get you down there. We'll sort out kit later, shall we? Yeah? Shall we?
Okay.
Yeah? Yeah, let's do it, mate. Come on then.
Great, thank you. Thanks, Will. Thank you, Lloyd. So, what did
banana?
What did we think of that? Oh, Fran, could you, we'll get a microphone.
Oh, here we go.
Here we go. Get your steps up. So, hands up then, if you can tell us what you saw there. Lovely, we've got a hand up here.
Yeah. When the scene, the support worker was good at encouraging, but maybe the advice it offered wasn't as helpful as what it could have been. Okay. Maybe he should have said yes, we can go to the GP as well and see what they suggest. Great. And also, obviously we know about the gym, but then there's the financial aspect of going to the gym. As we know, gyms can be very expensive. Where going for a walk, yes, I know we know the health benefits about running, but running is not suitable for everybody, is it?
Absolutely.
And so walking As for me, I'm not very fit anyway. I admit to that, but walking's one of my things I really love, and I think that's a free activity that people can get out, even if it's half an hour a day. Just do that. But I think going to see a health professional is the main thing from that, because they're the best advice. I know we do have gym instructors that give advice, but to me it's better if you speak to a health professional.
Thank you. Yeah.
I think this is better if you go to the doctor first and then see what they say, and it is up to the client to whether they go to gym or not, and the support they should have said to it. It's up to you. Do you want to come to gym or walk or run? And anything you feel up to it. But as the support was saying, it is beneficial to go for a walk there. And not sitting down. And for him to take the crisps off, he should have advised his client to it's crisp, maybe crisp have the all piece of fruits more healthy, and that's it.
Thank you. So some really good points there. So we're not saying that the support worker Ellis maybe didn't want to help. He did seem to want to help, but maybe didn't go about it in the best way. So you said the counter of Darren was saying he wanted to go to the doctor, and actually that could be a good place to start. Also, running isn't for everyone. It isn't the only way to keep fit. Walking might be more appropriate in this situation for this person, and everyone has a right to choose. So you were saying about taking the crisps off him. Again, there's a valid point there about healthy food, but just to take them off him didn't feel right. He should have advised him about the choices. Yeah, great points there, absolutely. Any other thoughts there about what Darren wanted, what his wants were in that situation? Victoria?
I rather thought that when he was running into the room, kind of like jumping in on the client.
Right, yeah.
Space.
Yeah.
That's how it be a little bit.
Right, yes, so an issue with personal space.
Yeah. So that's the whole bubble scenario where he's got his own little space.
Yes. Right from the beginning then.
Literally just jumping in and going, do you want to go to the gym?
Yeah.
Not giving the choice to sort of say, hang on a minute, you're way too close to me.
Yeah. Yeah. So, giving him
he might not feel comfortable having him quite so close.
Not respecting his space. And remembering we're in Darren's home here, so it didn't feel like that to me. I don't know what anybody else thought about that. Absolutely.
I think that was brilliant, and sadly, I've seen that, I've observed that so many times, so well done, it was absolutely brilliantly done. But I don't think I was listening properly. It was listening to me that it was, oh, I'm fit, it's easy, you know, we really didn't listen, so
So when we're talking about barriers, a barrier there was not being listened to and not actively listening, and imposing his own idea of what works for him, maybe well-meaning, but not effective in this situation, and maybe has the opposite effect on the person. Thank you.
I think Lloyd was thinking about himself. If Lloyd wants to go to the gym now, he's already swam from the stats into the
I've got a big laugh, Lloyd. He's got his own issues. Yeah, so maybe there was a little bit of selfishness there in terms of, well, being fit is a priority for him, and he's here today, but actually that would help his own sort of needs if he were to go to the gym. Fran, Wayne? Yeah.
one of the interesting I can speak.
Oh, yes. Check, darling.
I think one of the interesting things there is about whether you're a direct payment support worker or you're working for an organisation. Because if you're working for an organisation, you'd have a clear understanding of the support plan for Will and what you should be doing and what Will's aspirations are. But I wonder whether there are questions around when people use direct payments. Actually, where is the power in that relationship? Is it with the support worker that comes in and tries to force someone to do something? So I think there's some really interesting questions around how direct payments are used and whether the power, as it should do, sits with the person with a learning disability.
So the context of the support and how it's set up, and you know, is this a conversation that's happened many times? You know, I feel like it's, you know, there's a point where the character then says, "Oh, it's your day," because he says, "What do you want to do?" "Oh, what do you want to do? It's your day." But then he goes on to impose his idea of what to do. So is this a conversation that's happened many times? Are there sort of structural changes that need to be made around, has the support worker not received all the information that is important for this person? Training, yeah, absolutely.
Make sure that the person, like you said, the direct payment, a lot of people with disabilities don't understand their rights, what they can and can't do on their autonomy. Because a lot of people with disabilities get people speaking on behalf of them, where we're more than capable of speaking for ourselves.
Yeah.
So it's all about that as well, because I think a lot of services can be very overpowering and take over when they shouldn't be.
Yeah. So some brilliant thoughts here, some really interesting points. Yes, please.
Can I just mention something? I know I got lost voice, but I prefer being on microphone. But one thing is, in the Fit Conway thing, the schedule, if you have got a learning disability, you can get a fit card. That there is a scheme you can do it. And in Gwynedd too as well. So they have got schemes as well.
Yeah, fantastic.
So,
So finding out about what your rights are and what you're eligible for.
Yeah.
We're going to move on because there's loads of good thoughts there, loads of good points. Now we want to put them into action. So we're going to watch the scene again. And this time, any time that you see a point where Darren can do something differently to get what he wants, I want you to shout stop. So let's have a little practice of shouting stop. So after 3, I want you to raise your hand and shout stop. 1, 2, 3. Stop! Oh, you can do better than that. Let's try again. 1, 2, 3. Stop! Oh, yes! Yes! Absolutely not! Yes. Okay, so if you see a point where Darren can do something differently, shout stop and we'll ask you for your thoughts. And then you might get a chance to come up and play the role of Darren. Oh, God. Oh, God. Okay, it's my favourite reaction to it. And I should say also, whilst we're delivering this in English, but of course, if anyone wants to contribute in Welsh, then that is, please do, that is welcome. So we're going to go back to the beginning. But I'm going to fall over the speaker. Okay.
Darren, my friend, good morning. How you doing?
Stop! Yes, good, fantastic. First person to stop here. What's your name? Sorry, Paul. Tell us why you stopped, Paul.
Well, someone else said this point earlier. This one is your living room in your house. A bit of respect, please. And the other is personal space. Get your hands off me.
Fantastic. And Victoria, I saw you sort of half raise your hand and then put it back down. Did you have anything you wanted to add there? Okay, so personal space, and somebody else said here personal space. Okay, and we have a hand.
I would add a rang the doorbell, knock first before anything happens.
Right. Okay. So you think actually there should be they should agree that he should be knocking, or okay.
But maybe he can answer the door himself.
For him to answer the door. Okay. Yes.
When we have support workers come in to help my wife with her support, they normally, as they come into the house, they'll say hello. They'll shout hello so that we know that they're there.
Okay.
So they greet as they come through the door.
So maybe there's a conversation that needs to happen then around how what how Darren would prefer the character of Ellis to enter. Do we think? Yes, you prefer him to maybe shake his hand. Yeah. Yeah.
Or you agree? Because a lot of us, like with autism, we don't like our, as I say, space. There's some people like space invaders. And we don't know the rule of the space. I don't like strangers coming up to me just like touching me and coming right in my face. It really annoys me.
So
and I will tell you to go.
Okay.
But I think with, like, if you're having a support service, all these need to be agreed, and like you said, there should be like an action plan or in place about communication and what we like, what we don't like. So I think it helps a lot.
So do we have anyone who's brave enough to come up and take the role of Darren? Hand up there. Yes, Victoria. So you're going to sit in Will's place. You're going to play Darren. And we're going to go from the beginning, from the tap on the shoulders, and then Victoria.
You need her microphone.
I think we'll get to here. It'll be okay. So respond in a way where, what have we said about making it clear about boundaries?
About I sort of make the point that they
knock on the door. Yeah, maybe that you prefer them to knock on the door. Yeah? Okay. And now, we're not going to shout stop. You're not going to shout stop. Either Victoria will stop it or I will stop it if I feel laid down.
If I forget, you can.
Okay, right. Okay, we're going to go from your entrance.
Darren, my friend, good morning. How are you doing?
Yeah, hold on a minute. That was getting in my personal space a wee bit.
Oh, sorry.
Sorry.
We're mates, aren't we? So
yeah,
we're
it's just got a sort of, space between people, otherwise it kind of get in there, kind of double.
Oh, right, okay. So you don't want me to...
No.
What would you prefer me to do?
Just handshake me.
Just a handshake?
Yeah.
Okay. Okay, that's great. Okay, I'll try and remember next time, that's it.
Yeah.
Okay?
Yeah.
Cool.
Okay, lovely. Pause there. Fantastic. How was that, Victoria?
Oh, a little bit bad telling them off, to be fair, but...
Okay. You felt bad telling him off?
Yeah, but then I realised we're acting.
You realised you're acting, yeah. Okay.
That's how you build the relationship with the staff you're working with. Communication is the
I
key.
was trying to be
And that's where
perfect.
it's always lacking, is the communication.
Yeah, and it can feel uncomfortable, depending on your own personality, it can feel really uncomfortable to say what your needs are. It's not something that lots of people do very comfortably. So, yeah, it's good to acknowledge, oh, I felt a bit bad, but actually, as you said, Ruth, it's necessary so that the boundaries are clear. Did we see any progress there? What effect did it have on Ellis? Yes.
I think you realise that there has to be boundaries.
Yeah.
When you work with
Yeah.
I know you're a friend, but you've got to have professional standards in my eyes as well.
Yeah.
And some people blur the line sometimes.
Yeah.
When they get to know each other too well.
Yeah. How did you feel, Ellis, in that situation?
Definitely, as you said, it's the boundaries. So obviously overconfident coming into the room and this boundary. But I don't know how Darren's feeling. That's it, and then you scared the life out of me. Stop that kind of momentum. So it made me stop and think and recognise what you're saying.
Yeah, because that's one thing I've learned is always keep, even if it's a professional work, it's someone who perhaps you don't know quite so well.
Fantastic. Well done. We're going to go back in place. So we're going to move it on. Okay, so we're going to move on from that point and what have you been up to? So we're going to go from what have you been up to and then just relaxing. Again, this time you can chat stop if you see a point for Darren to do something differently. Okay.
What have you been up to then?
Oh, just relaxing.
Relaxing.
Stop! Good, okay. Hands up there who shouted stop. Okay, lovely. Tell me why you shouted.
I shouted stop a bit too late, I think. It was if you're not very
We can't hear you. Too quiet. judgy.
Judgy, very judgy.
Non-verbals were judgy. Lovely. Here, what were your thoughts there?
He was in his face a lot.
In his face, yeah?
Ha! He was in his face a lot.
Yeah.
I would like to be, what's the word? Not in your face a lot.
Right.
I can't think of the word. Yeah. Not in your face a lot.
Just
more space.
More space.
Yes.
Okay.
Breathing.
Lovely.
Breathing space.
Breathing space. Great. Okay.
Television was loud, or the television was on. Perhaps he might have suggested we turn the volume down a little bit.
Okay.
Maybe turn the television off just briefly so we can have a bit of a catch up because he's not really seen these days. And have that conversation with him so he can clearly listen and hear what he's saying.
Okay. So instead of Darren turning the TV off, we want him to use his words more and say, "Oh, I can't quite hear you," or "You're distracted." Not Darren, Ellis. So what can Darren do about that then? Because that's Ellis's behaviour. What can Darren do to change that?
You can ask him.
I'd like to ask you, do you mind, and I'd like to take my machine, remote control, support worker could that. Do you mind me turning it off or not?
Okay. So actually, what Darren needs to say is, do you mind not taking the remote control? I was watching that, and then that gives Ellis a choice to, I mean, would you like to get up and have a go and play the role of Darren in that moment? Richard? Yeah? So what have you been up to? Relaxing, and we're going to, so if you hand Richard the remote control and your crisps, and you're going to play that out, Richard. I'm aware that we're at 1 o'clock, so we're going to make this our last intervention. We've had so much interesting conversation. I'm just wondering whether you all afternoon, but we can't. Okay, so we're going to go from what have you been up to?
What have you been up to then?
About Coronation Street, that turned into a movie.
Okay. Well,
would you like that to
Stop! Wait. Let's play out. Hang on. Let's see what Richard was going to say there.
I was watching that, so I don't really coming to the end of it, Lisa.
Oh yeah, I was just turning it off so we could go out and do something.
Yes. Is it okay if I walk back to the end of it, then when we can go out? So.
Well, what if we turn it off and we will go out now? Because, you know, no time like the present, can't play the end of that.
Is it okay if I actually record it? Don't put it on the laptop. Oh, yeah.
Record, you want to record? If you press record, then I'll take it off. Do you want me to do it actually? Yeah? There we go. Okay. Okay, what do you want to do?
Okay, how was that, Richard?
I just trying to be talking. Being assertive.
Yeah, being assertive, being more assertive, and you sort of negotiated a bit, didn't you? Should we see what the audience thought of that?
Yes.
What did we think there? Was there any progress?
It was all right, but Richard can stop it. Richard knows how to work the remote control. He's very capable of pressing the button record.
Okay,
so even we've got a learning disability, we're more than capable of doing things ourselves. If we want help, we will ask for it. Don't assume that we can't do things.
Bit patronising.
Yes, we will tell you.
Yes,
And that's
great.
what I'm taking.
Don't presume, yeah, absolutely. Has got a hand up there?
I think Richard did make his points clear. He was just being really respectful that Ellis just still wasn't listening.
Yeah, absolutely. So he was, what was his point? What did he want? He wanted to finish what he was watching, yeah. And then he
say you were very proactive of it. You're very polite. But I think if I was in that situation, my response, if someone took control of me, would be like, what are you doing? What's going on? Because you're sat in your house with your remote control watching your television and someone's come and snatched it off you.
So some people maybe would have even pushed it a bit further. And really where we're running over time, so we're going to draw it to a close there. Thank you. So thank you all very much for your contributions. I'm aware that we've only really scratched the surface there of the things that could be changed within that scenario, and we haven't fully resolved it. But what we have had lots of really interesting discussions around a person's right to choose and their autonomy, and lots of really strong points here about, don't presume what people's needs are, actually check in with people's preferences and boundaries. And yeah, thank you all very much. Thank you to our actors. Thank you for having us.
Sorry about that. Thank you very much for everyone at Hijinks. That was wonderful. I'm going to ask you to go to your second workshop now. All the details are in your packs, but if you're not sure where to go, please ask one of our staff in the red top. And then we'll be able to help you. After the workshop, please come back here and make back.
And thank you to Fran for the microphone support.
Welcome everyone back to the workshops. Ignore that bit. Hello again. We now have Laura Andrews from Recruitment Cymru, who's going to tell us all about health profiles.
I promise I'll be quick because it's the end of the day and I've been late for so many routine. I've all got shifts at the premier. So I'm Laura Andrews. I'm the Senior Improvement Manager for Improvement Cymru on the physical health pathway for people with a learning disability. And I'm here this afternoon to talk to you about the health profile, which has been mentioned periodically all the way through the day, which is a good thing. It lifts my spirits a bit. First question is, how many people have heard of the health profile? Yeah? Hopefully all of you have heard of the health profile. So, how many of you actually have a health profile? A significantly lower number. In fact, no one. Okay? How many people here have used a health profile or helped somebody use a health profile? That's better news. Thank you. Okay? So, what is the health profile? So the health profile is a patient safety tool. It is there to protect people with a learning disability when they have any kind of health interaction. So when they are visiting the GP, going into hospital, when you go and see the dentist. Yeah? It gives important information to health professionals about you. And it's owned by you, the individual with learning disabilities. It is your property, and it's the information that you want to give people. And it was designed in collaboration with people with a learning disability, carers, and professionals. And those professionals were professionals working in the general sector, so working in general hospitals, in accident and emergency units, learning disability staff, and the University of South Wales brought it all together. And the reason that we've developed the All Wales Health Profile is because when the University of South Wales looked into health passports and all the other communication tools there are for people with a learning disability, there were over 60 variations of it. So we decided that if we had one document that met the needs of everybody, then that would make more sense, because then staff know what they're looking for when you come into hospital. Okay? And it's deliberately only 4 pages long. Yeah? I constantly have arguments with learning disability nurses, and I am one, because they say there's not enough room, Laura, to put this information in. The idea is that it is kept short because this is an emergency situation. I call it your George Clooney moment, yeah? So, because I'm old enough to remember ER, and I still fancy it. So, your George Clooney moment is, while he's rushing down the corridor with you lying on the bed going, oh, hello, George. Yeah? It's the information that you shout at him to stop him killing you. Yeah? That's what your health profile is. Okay? So, Sean says it much better than I do. Oh, I've stopped it now completely.
Why did these videos never work?
Hi, I'm Sean, and I have a learning disability. I use a health profile. It's a booklet about me that gives healthcare staff like doctors and nurses important information about me, such as how to communicate with me and what help I need in making decisions about my family. The information will help them give me the care I need at the right time. I find it helpful to use my health profile when I go to any appointments in the hospital or in the community, like my GP surgery, dentist, or optician. By reading my health profile, staff will know how they can best support me. For example, I need people to take time to explain things to me. It can help make my appointment easier and a more positive experience for all. I can fill it in myself or ask someone who knows me well to fill it in, such as my family, friend, support staff, or community nurse. I keep it up to date and remember, take the health profile with me to all my health appointments.
That was fast.
Quick one. So, why is the health profile important? All of these people in these pictures, and in the bottom left-hand corner is Paul Reid, who you heard about this morning. All of these people in these pictures died at the hands of the NHS. They died early, and they died of preventable diseases. Yeah? So that's why we've got the health profile. Because we know that people are dying younger than the general population. So people with a learning disability, men are dying 22 years younger, and women are dying 26 years younger than the general population. We know that 6 out of 10 people with a learning disability die before the age of 65, in comparison to 1 in 10 in the general population. Yeah? We know that COVID-19 killed double the amount of people with a learning disability than it did in comparable to the general population. We know that 64% of those people died with a DNA CPR in place. So a DNA CPR is do not attempt cardiopulmonary resuscitation. So that means that they won't try and save you if you have a heart attack. And some of those were put in place unnecessarily. So your health profile helps clarify some of those issues and helps you in advance have stated what your wishes are. Yeah? We know that 61% of people with a learning disability die in hospital. Okay? And we know, I'm sorry I've upset. We know that 11% of those deaths are due to sepsis, and we know that sepsis isn't well recognised by unqualified carers in the community, and very often people with a learning disability are presenting to hospital too late with sepsis, and that's why people are dying, because we don't recognise the signs and symptoms of sepsis. And we know that 50% of those deaths are preventable, and that's why I'm here, and that's what the health profile's for, and that's what we want to do, is make a difference and stop these people dying. Sorry, that was quite hard hitting, but it gets through the importance of what we're
I'm
doing.
shocked with the statistics I don't know
That's-
any reason
yeah.
I've got on LD myself. Really scary.
But that's why it's so important, because we need to protect people.
Yeah.
Yeah? So, how should we use the health profile? So we use the health profile whenever there's an appointment with any kind of health professional. Take it with you. If it's the optician, if it's your dietitian, if it's your GP, when you go into hospital, give it to the ambulance crew if you get called out, if you phone an ambulance. Yeah? Because that has the essential information that those professionals need to be able to support you well. So how do you complete it? Because we talk about it lots, and there's guidance on the website, and I'll give you the details of the website in a minute. But actually, how do we fill it in? Because what we found is people aren't reading how to do it, so I'm going to tell you now today. Okay? You have no choice, you're sitting here. So, there are user guides, and there are user guides for people with a learning disability. There's an easy read version. There are user guides for families and carers, and there are user guides for professionals. So the professionals guide is to guide the staff who don't work in learning disability services on how to use the health profile as well. So it gives those people some guidance in what to expect from the health profile. Okay? So your front page, there's Sean's picture there. You fill in all the information on the front page, and that is your basic information on you. So it's your name, it's your date of birth. If you put a photograph on it, evidence shows us that it personalises it and it makes it more powerful for health professionals. So you don't have to put a photo on it, but if you do, it makes it more personal for people and they can't ignore it. And they know it's about you. It's not just a name on a piece of paper. That's a person. Yeah? And every time something changes on that, your medication or anything changes, you need to update your health profile because it's really important that what you're taking with you is current. Okay? So, My Health, which is page 2 of your health profile. In there, you need to mention, so there's one section which is My Health Needs. Now, remember what I said about George Clooney, because I do like to talk about him a lot. This is the essential information that he needs to know to not kill me. So he needs to know that I've got asthma, so I could be having difficulty breathing because I've got asthma, yeah? That I'm prone to constipation. So that will give him a clue. When he's looking at you and you're not able to tell him how you're feeling, it gives them a clue on what might be wrong with you. And that's why it's important. They don't need to know that you had an ingrown toenail in 1973, but they do need to know the major stuff that's happened to you. So they need to know if you've got diabetes, known health conditions, and if you've had some big operations in the past, because that gives them a clue where to look. Yeah? Things you're allergic to as well, because I find that helps, because then they don't give you something that might kill you. Yeah? And your medication, which again gives them a clue to what some of the symptoms you're showing might be, and actually means that they don't give you medication that might it might be contraindicated, which is they might work against each other, two drugs, or they might not. One drug might make the other one worse. Yeah. And really importantly as well, it's how you show you're unwell or ill. So what is it about you? Do you go quiet? Do you go pale? It's those little things that normally your mother knows about you and you don't necessarily know. Yeah? But your mum always knows, doesn't she? She goes, you're not well, what's the matter? Yeah? So ask your mum, what is it about me when you say that? And that's what you write down, that's how you know it. Yeah? My support on page 3 and 4. And this is where I start arguing with the LD nurses in the room. Yeah? Because it says things about eating and drinking, your support needs. And I don't need your whole care plan. George Clooney hasn't got time to read your whole care plan. Yeah? He just needs to know the key information about you. That the reason you're not walking is because you haven't walked since 1963. Yeah? So it's not going to be a miracle and you're not suddenly going to get up and start walking. They just need to know that essential information about you and whether you're continent or not continent, because that helps inform their care and means that they're going to give you better support in a busy department. Whether you're prone to seizures as well, so they need to know if you've got epilepsy and how that epilepsy looks and how it presents itself, because again, that gives them clues as to why you're there and what's the matter with you. If you have got a care plan, you are more than welcome to attach your care plan to the back of the health profile. But what I will say is, in A&E, they will not read it because they don't have time. But if you do get admitted to a ward and it goes up with you, the staff on the ward will have more time to be able to read that. So it's good to have it there because it can inform care and it may answer some questions for staff if they need to. Yeah. Your communication, this is the really important bit as well. So it's, if you tell us about any problems you have with hearing or speaking, if you use anything to help you communicate, like Makaton or Sign-Along, or you're better with pictures or objects, if you need people to use short sentences and clear words, if the way you communicate changes when you're worried or anxious, because let's be honest, we're all worried and anxious when we hit a hospital appointment or the GPs. We all have those little thoughts going around our heads, yeah? And how people can help you. And if you have got challenging behaviour, tell people how that might present itself. So it might be, when I'm worried and upset, I need a bigger personal space, and if you come into that space, I might hit you. But what you need to do as well is tell people what to do about it. So add your behaviour support plan onto the back, because it's no use just telling people what you do. You need to know how we can help you with it as well. Yeah. The last page on it is anything else that you want people to know. So that might be any particular religious beliefs you might have. If you have any plans like your behaviour support plan. And on that back page, write, I have a behaviour support plan, see attached. I have a care plan, see attached. Yeah? So those are there to inform care when they've got time to read them. But in A&E, they may not have time to read them, and we have to understand that. Yeah? And you might want to write on some contact details of people that you want to support you if something happens and you end up in A&E. So it might be your next of kin. Your mum might be the last person you want in A&E with you. So if that's the case, then write that and say, actually, my mum's down as my next of kin, but I'd rather have my boyfriend there. Yeah? It's perfectly fine to do that. So how will it be used? Remember to take it with you wherever you go, and it's designed to give key information. So I always say just think George Clooney. There you are, I've mentioned him again. If you need to go to hospital anywhere, it's designed to give the key information that people need. You can insist as well that people take 5 minutes to read it. You are perfectly within your right. It is a reasonable adjustment. We've banged on about that all day today as well, haven't we? It is a reasonable adjustment that is there to protect your health, and it is not unreasonable to ask somebody to take 5 minutes to read your health profile. Yeah? And you can give it to the ambulance crew, which I've already mentioned, and it should be kept with you. It belongs to you, not in the notes. If it goes in the notes, it disappears, and it is never to be seen again. Yeah? And the likelihood of people reading it when it's in the notes is low. So keep it with you. I always advise people, if you take a paper copy of it with you, to laminate it, because then they can't throw infection control at you either, because it can be wiped clean with alcohol gel to protect people. So if you can have a laminated copy with you, it doesn't matter if it's just a paper copy, it really doesn't matter, but it's your property and you keep it with you. How do you get a health profile? I really impressed myself with this slide, can I just say? That is the first time I've ever made a QR code. I didn't even know what a QR code was until I did this. And then Beth showed me you can change the colours and everything on it. So that's the QR code that takes you to the page where the health profile is. And it's, if you put in the Once for Wales health profile, it's on the Public Health Wales website. Okay? And there's a couple of copies there, yeah. So,
Yeah, now the nothing wrong.
thank you. And remember, reasonable adjustments are everybody's responsibility, and it's not unreasonable to ask for them. Yeah? So, we've had a recent review of the health profile, so you're getting new news here. Okay. We've reviewed the health profile recently, and some of the findings of it have shown us that families weren't aware of the new profile, and in particular, they weren't aware of the guidance that was available around it. That the health profile should be viewed as emergency information, not a full care plan. We need to focus on how it helps health professionals as well. And we need to develop an electronic version of it that people can keep on their phone with them, so that's updated more often. And we're actually in discussion with NHS, the NHS app, the people who are behind that, to look at getting it incorporated onto the NHS app. That may take us some time, but we are looking at it. Yeah? And we need to promote the guidance. We need to promote the guidance available. So, exciting times ahead. Watch this space, because we will be relaunching the health profile. And you will be hearing from me again, and probably George Clooney. Yes. They shouldn't do. We're gradually phasing out all the other ones. So people will have the old health passports at the moment, but as it comes up for renewal and review, we're moving over onto the new health profile. Okay. Yes.
So when it's relaunched, will it be the same as it is now, or will you be adjusting it based on feedback that people have given?
So the University of South Wales who developed it have reviewed it, and they've spoken to people with a learning disability, they've spoken to professionals who use it, families and carers. So these are the recommendations that they've made. So what we'll do is we'll be in discussion with them, look at the health profile, and then we'll relaunch it across Wales again. The unfortunate thing with the health profile when we first launched it was we launched it and then went straight into COVID lockdown. So it kind of got lost in translation. This is the ideal opportunity to relaunch it and emphasise how important the health profile is for people.
Because one point I've heard from health professionals is it doesn't stand out in the same way as the old ones used to do in terms of being different from other medical documents that flying around in an emergency. So do you think there might be a way it could be changed so that immediately people can see just even from over here?
Yeah, so that's the importance of the photograph on the front, because the photograph stands out, and that's what A&E staff have said stands out best to them. If there's a photograph on something, they know it's about the individual.
Yeah. Real as well.
Sorry?
So when you put somebody on the day, it makes it real, it's not a document. This is somebody, so how often you read a document and it's talking about somebody, but
you don't know who they are.
What a person looks like on that picture.
It personalises it.
To make it real.
Anything else? I shall leave then. Thank you very much.
Thank you for that, Laura. A big thank you to all of our speakers, workshop leaders, exhibitors, and all of our delegates today. Before we finish off, I just wanted to ask Zoe back to the stage to say a few words, talking about one last note as well. With the headsets, if you've got any, please leave them on your chairs. If you've got any of the translation headsets.
Okay, Victoria.
Thank you. But yeah, talking about guys, thank you.
We're getting you home on time. It's been a great day, thank you. We've learned so much about different possibilities in Wales, I think. Possibilities of sharing good practice and seeing how things work. We've had wonderful workshops where we've explored mindfulness, creative arts, sex and relationships, and vaccine, easy research of the vaccine. But I think that we must remember that unless we are doing these things and doing them actively, we can have devastating effects, as we heard from Jonathan earlier on. And we do know that Jonathan's brother's case, Paul Paul's case isn't a unique case, and that still happens at the moment. So we still have a huge amount of work to do. And if we can go away with some takeaways today of what we are going to do to either look after our own health or to support other people to look after their health, that will be a great thing from the conference today. I want to just ask you, very politely, to fill in your evaluation forms. It's really important for us to hear what's been important for you today, what you've liked, what you've disliked. Fran, vegetarian buffet, you take that away, we know.
100%.
Okay.
Well, you should know me by now, my face.
I know. So it's important, really important, that we have those evaluation forms in from you. Danielle is waiting on the front door to not allow you out without us taking them. I want to say a big thank you to Victoria. It's been your first day as chair today. It's really important for us that people with a learning disability lead a conference and bring with them their own experiences as well. If you're not staying for the AGM with us this afternoon, I'd like to bid you a safe journey home. Thank you very much. Some of you will see in South Wales next week. Yes, and some of you will see throughout the year. So thank you very much and safe journey.
Yeah.